Have you ever felt so down that it feels like a heavy, dark cloud is following you everywhere, and no matter what you do, you just can't shake it? If that feeling sticks around, it might be more than just a bad mood. Today, we're going to talk about something incredibly important: depression. And stick with me, because by the end of this video, you'll understand what it really is, why it happens, and most importantly, how it can be treated. So, what exactly is depression? Officially known as major depressive disorder, it's a serious medical condition that affects how you feel, think, and handle your day-to-day life. Things like sleeping, eating, or even going to work can feel like climbing a mountain. It's crucial to understand that depression isn't just about sadness. It's not a sign of personal weakness, and you can't just snap out of it. It's a genuine illness with real biological and psychological roots that often requires professional help to get better. To really get what depression feels like, we need to look at the specific symptoms. For a diagnosis, these symptoms need to be present for at least 2 weeks and mark a real change from how you used to be. Let's break them down into 3 categories: emotional, physical, and cognitive. First, the emotional and psychological symptoms. The most classic one is a persistent sad, anxious, or empty feeling. It's not just fleeting sadness, it's a deep, pervasive sense of hopelessness. Another huge red flag is losing interest or pleasure in things you once loved. This is called anhedonia. Maybe you used to love painting, hanging out with friends, or playing sports, but now it all feels pointless and brings you no joy. People with depression often feel a sense of pessimism, believing that things will never improve. They can also be consumed by feelings of guilt, worthlessness, or helplessness, often blaming themselves for things that are completely out of their control. You might also notice increased irritability or frustration, even over small things. This is especially common in men and teenagers. And the most serious symptom is thoughts of death or suicide. This can range from a passive thought, like wishing you wouldn't wake up, to making specific plans. If you or anyone you know is having these thoughts, it's a medical emergency, and you need to seek immediate help. Next up are the physical symptoms, which can be just as debilitating. Many people experience significant changes in their appetite or weight, either losing or gaining a noticeable amount without trying. Sleep can get completely disrupted. Some people develop insomnia, where they can't fall asleep or stay asleep, while others might sleep way too much, a condition called hypersomnia. A profound loss of energy is another key symptom. Even small tasks feel exhausting, and you feel physically drained all the time. You might also notice something called psychomotor changes. This can look like agitation, being restless, pacing, or wringing your hands, or the complete opposite, where your movements and speech become noticeably slowed down. Finally, many people with depression suffer from unexplained physical aches and pains, like chronic headaches, back pain, or digestive issues that don't get better with typical treatments. And finally, let's talk about the cognitive symptoms, how depression affects your thinking. A common complaint is brain fog. It can become incredibly difficult to concentrate, think clearly, or make decisions. Reading a book, following a conversation, or even deciding what to eat for breakfast can feel overwhelming. Memory problems, especially with short-term memory, are also frequent. It's not that you're just being forgetful. Your brain's processing power is genuinely impacted by the illness. So, why does this happen? What causes depression? The truth is, there's no single answer. It's a complex mix of biological, psychological, and environmental factors. From a biological standpoint, an imbalance in brain chemicals called neurotransmitters like serotonin and dopamine plays a huge role. Genetics can also make you more susceptible. If a close family member has depression, your risk increases. Hormonal changes, like those from thyroid problems, childbirth, or menopause, can also trigger it. Psychologically, certain personality traits can increase your risk. such as having low self-esteem, being highly self-critical, or having a pessimistic outlook. Traumatic experiences in early childhood, like abuse or neglect, can cause long-term changes in the brain that make you more vulnerable to depression later in life. And then there are the environmental and social factors. Chronic stress from work, finances, or a difficult relationship can wear you down. Major life events like the death of a loved one, a divorce, or losing a job can be powerful triggers. And never underestimate the impact of social isolation. Loneliness and not having a strong support system are significant risk factors for depression. It's also worth knowing that depression comes in several forms. The most common is major depressive disorder, with the intense symptoms we've discussed. Then there's persistent depressive disorder, or dysthymia, which is a chronic, low-grade depression lasting for at least 2 years. Postpartum depression can affect new mothers, and it's far more severe than the baby blues. Some people experience seasonal affective disorder, or SAD, which typically occurs during the darker winter months. In very severe cases, depression can come with psychotic features like delusions or hallucinations. And another type is premenstrual dysphoric disorder, or PMDD, which is a severe and disabling form of PMS. Now, after all that heavy information, here is the most important and hopeful part. Depression is one of the most treatable mental health conditions. In fact, between 80 and 90% of people with depression eventually respond well to treatment. So, what does treatment look like? One of the cornerstones is psychotherapy or talk therapy. Cognitive behavioral therapy, or CBT, is highly effective. It helps you identify and change negative thought patterns and behaviors. Interpersonal therapy focuses on improving your relationships and adapting to new social roles. Medication is another major tool. Antidepressants, like SSRIs, work by rebalancing those brain chemicals we talked about earlier. It's important to be patient, as it can take several weeks to feel the full effects, and sometimes it takes a little trial and error to find the right medication and dosage for you. For severe, treatment-resistant depression, there are also brain stimulation therapies like ECT and TMS, which are safe and effective procedures performed under medical supervision. And finally, never underestimate the power of lifestyle changes and self-care. Regular exercise is a fantastic mood booster. A healthy, nutrient-rich diet supports your brain health. A consistent sleep schedule is vital for regulating your mood. It's also wise to avoid alcohol and recreational drugs, which can make depression worse. And practices like mindfulness and meditation can be excellent tools for managing stress and breaking the cycle of negative thoughts. The most crucial takeaway from all of this is that if you or someone you know is struggling with these symptoms, please seek help. Talk to a doctor, a psychiatrist, or a psychologist. Depression is a real illness, just like diabetes or heart disease. It is not a character flaw, and reaching out for help is a sign of incredible strength, not weakness. Thank you so much for watching and for taking the time to understand this important topic. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on mental health and well-being. Take care of yourselves and each other.